Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Rybelsus vs Ozempic Similarities and Differences. When comparing Rybelsus vs Ozempic, you may be aware of their similarities. As two type 2 diabetes medications in the same prescription drug class, glucagonlike peptide 1, GLP-1, agonists, both non-insulin options help to lower blood sugar and expedite weight loss. /r/n/r/n However, when deciding which medication might be right for you, it's helpful to consider some distinct differences between the two, such as dosage form, route of administration, and dosing frequency. /r/n/r/n A healthcare provider can help you determine whether Rybelsus, Semaglutide, or Ozempic, Semaglutide, is the right choice for you. /r/n/r/n Rybelsus and Ozempic share many similarities but have a few important differences. /r/n/r/n The main differences center around the dosage forms, frequency, strengths, and dosing schedules of the two medications. /r/n/r/n Form and administration, /r/n/r/n Frequency, /r/n/r/n Strengths and dosing schedules, /r/n/r/n Rybelsus tablets are available in 3 mg, mg, 7 mg, and 14 mg strengths. The typical starting dosage is 3 mg once daily and increases slowly, over several months, until you reach the target dose of 7 to 14 mg once daily. This is the dosage shown to control blood glucose, sugar, levels. /r/n/r/n Ozempic injection pens have several strengths, 2 mg per 3 milliliter, 2 mg/1.5 milliliters, 4 mg/3 milliliters, and 8 mg/3 milliliters. Each pen contains 0.25 mg, half a milligram, 1 mg, or 2 mg. The typical starting dosage of Ozempic is 0.25 mg once weekly. Your dose increases slowly, over several months, until you reach the target dose of half a milligram, 1 mg, or 2 mg once weekly. /r/n/r/n The table below summarizes some key differences between Rybelsus and Ozempic. /r/n/r/n Rybelsus and Ozempic are brand name medications with the same active ingredient, semaglutide. Semaglutide, a GLP-1 agonist, works by mimicking a natural protein to stimulate insulin secretion. /r/n/r/n The Food and Drug Administration, FDA, has approved both Rybelsus and Ozempic for controlling blood sugar levels in adults with type 2 diabetes, along with diet and exercise. /r/n/r/n Ozempic is also FDA approved to lower the risk of serious cardiovascular problems, mainly heart attack or stroke, in adults with type 2 diabetes. /r/n/r/n Healthcare providers also prescribe GLP-1 agonists for weight loss. During clinical trials, people with and without type 2 diabetes who took Rybelsus or Ozempic experienced significant weight loss. /r/n/r/n Based on these results, providers sometimes prescribe Rybelsus or Ozempic off-label to assist in weight management for overweight or obese individuals. /r/n/r/n However, this would be an off-label use since Rybelsus and Ozempic are not specifically FDA approved for weight loss. /r/n/r/n So far, no studies directly compare the effectiveness of Rybelsus and Ozempic. However, the results of two separate but similar clinical trials allow for a robust comparison of the effectiveness of each. /r/n/r/n Overall, Rybelsus and Ozempic provide similar blood glucose levels and weight reduction. In clinical trials, Ozempic, 1 mg weekly, and Rybelsus, 14 mg daily, resulted in decreases in hemoglobin A1c, a measurement reflecting your average blood glucose levels over the past 3 months, of 1.6% and 1.4%, respectively. /r/n/r/n. In addition, Ozempic, 1 mg weekly, and Rybelsus, 14 mg daily, led to a weight loss of 9.9 pounds and 8.2 pounds over about 30 weeks, respectively. These results suggest that Rybelsus, 14 mg daily, and Ozempic, 1 mg weekly, are similarly effective. /r/n/r/n. Note that 14 mg daily is the maximum dose of Rybelsus, equivalent to 1 mg weekly of Ozempic. /r/n/r/n. However, a healthcare provider may prescribe up to 2 mg weekly for Ozempic. /r/n/r/n. In studies, people taking Ozempic, 2 mg weekly, experienced even more weight loss and A1C reduction than those taking Ozempic, 1 mg weekly. /r/n/r/n. Since Rybelsus and Ozempic contain the same active ingredient, Semaglutide, they have similar side effects. /r/n/r/n. Most side effects for Rybelsus and Ozempic are mild and occur more frequently when you first start treatment or after the dose increases. /r/n/r/n. However, continuously monitor for emergency side effects if taking Rybelsus or Ozempic. /r/n/r/n. If any side effects begin to worsen or affect your ability to take either drug, contact your healthcare provider immediately. /r/n/r/n. Some of the more common side effects of Rybelsus and Ozempic include /r/n/r/n. Specific side effects of Rybelsus or Ozempic are unique to each drug. During separate clinical trials, Rybelsus caused decreased appetite in 6% to 9% of participants. /r/n/r/n. With Ozempic, fewer than 1% of participants experienced reduced appetite. In addition, Ozempic may cause injection site reactions or discomfort. /r/n/r/n. Rarely, treatment with Rybelsus or Ozempic may result in more severe side effects. Certain medical conditions or other medications can increase the risk of severe side effects. /r/n/r/n. Some of the more severe side effects of Rybelsus and Ozempic may include /r/n/r/n. Rybelsus and Ozempic have a boxed warning for the risk of thyroid C-cell tumors. The FDA requires boxed warnings for drugs that may cause potentially severe or dangerous side effects. /r/n/r/n. Rybelsus and Ozempic caused thyroid tumors in mice and rats during animal studies. It isn't known if the same effect could occur in humans. /r/n/r/n. As a precaution, however, Rybelsus and Ozempic are not recommended for people with a personal or family history of medullary thyroid carcinoma, MTC, a type of thyroid cancer, as well as those with multiple endocrine neoplasia syndrome type 2, MEN2. /r/n/r/n. The choice between Rybelsus and Ozempic depends on the patient's goals, preferences, and the professional opinion of their healthcare provider. /r/n/r/n. If you want to avoid needles, you might prefer Rybelsus tablets. Sometimes, insurance plans might cover one or the other, so cost is another consideration. /r/n/r/n. Switching between Rybelsus and Ozempic is possible. You might switch due to a change in your insurance coverage or personal preference, such as injection site irritation from Ozempic. /r/n/r/n. Talk to a healthcare provider before stopping or switching any medications. /r/n/r/n. Wegovy is another brand name prescription drug. It also contains semaglutide, the active ingredient in both Rybelsus and Ozempic. /r/n/r/n. Wegovy, however, is approved by the FDA specifically for weight management in adults and children ages 12 and older who have obesity or medical conditions related to being overweight. /r/n/r/n. Rybelsus and Ozempic have many similarities but also have significant differences. They both contain the same active ingredient, semaglutide. /r/n/r/n Rybelsus is an oral tablet version of semaglutide taken once daily, while Ozempic is a subcutaneous injection administered once weekly. /r/n/r/n Both medications lower blood glucose levels and aid in weight loss. Both drugs are used to treat type 2 diabetes, while Ozempic is also used to reduce the risk of heart attack and stroke in people with type 2 diabetes and heart disease. /r/n/r/n A healthcare provider can help determine which option may be right for you. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.